In today's digital climate, public figures are often reduced to headlines, keywords, and algorithms, frequently stripped of context and complexity. For those working in high-stakes, mission-driven professions, this dynamic is particularly damaging. Yasir Jawaid, however, stands as a model of how to lead with clarity, empathy, and consistency, qualities that defy the volatility of online narratives. Born in Houston, Texas, and raised in the rural desert region of Sindh, Pakistan, Yasir Jawaid developed an early appreciation for community, humility, and resilience. "I spent my childhood in a small company town," he recalls, "where I formed lasting friendships that shaped my understanding of trust and loyalty." Later, his family moved to Karachi, a city he credits with instilling a deep appreciation for energy, diversity, and innovation. That same appreciation followed him back to the United States, where he pursued medical training across West Virginia, New York City, and Washington, D.C. "Each place gave me a new lens," Jawaid explains. West Virginia was peaceful, humbling. New York offered unmatched intensity and collaboration. D.C. gave me a global perspective on health, government, and equity. This multicultural, multi-regional foundation now informs how he leads interdisciplinary teams and communicates with patients across backgrounds. The strength of Yasir Jawaid does not lie in titles or degrees. It lies in how he applies his experiences to the complex realities of modern medicine. As a physician leader operating in critical care and high-acuity environments, Jawaid's role requires not only technical skill but extraordinary emotional intelligence. Whether you're coordinating ECMO recovery or managing multiple departments, success depends on communication, he says. That means clarity, consistency, and active listening. In high-pressure settings, Jawaid uses standardized communication frameworks to ensure that no critical information gets lost. "I express only the most relevant details up front, ask what other information the team may need, and clearly define what scenarios require escalation or after-hours contact," he explains. This reduces uncertainty and empowers faster, safer decision-making. Jawaid also emphasizes the importance of understanding how other disciplines think. "I've learned what causes each team, surgery, cardiology, critical care, to intervene or stay back. That insight helps me anticipate their concerns and guide collaboration proactively," he says. This isn't just theory. Jawaid applies these principles in real time. When conflict or miscommunication arises, he remains calm and solution-focused. "I listen to each concern, clarify where the disconnect occurred, and realign everyone on the shared goal, patient outcomes. We don't let ego get in the way." By transforming friction into feedback, he creates a culture of continuous improvement. Within his team, Jawaid fosters collaboration by leading regular interdisciplinary meetings and encouraging open, respectful dialogue. When nurses, physicians, allied health professionals, and admins are aligned, everything from diagnosis to discharge runs smoother. "We reduce errors, shorten response times, and improve care quality," he says. One of the cornerstones of his leadership is adaptability, especially when working with virtual or rotating care teams. "During overnight shifts or when team members are remote, we maintain cohesion through scheduled check-ins and predefined roles. Everyone knows what's expected, and that creates psychological safety," Jawaid explains. He understands that structure and connection are not mutually exclusive, they're mutually reinforcing. With patients and families, Yasir Jawaid communicates with the same intentionality but a different tone. "I simplify complex medical concepts, avoid jargon, and make sure patients feel seen and heard. It's not just about treating the illness, it's about building trust," he says. In contrast, when speaking with peers or trainees, he leans into precision and academic rigor while still encouraging questions and open exchange. This dual focus, clarity and empathy, extends to how he gives and receives feedback. Effective feedback is specific, constructive, and kind. "I seek it out regularly, and I offer it with the goal of improving care, not criticizing people." He sees mentoring as an ethical obligation and believes that active listening is just as critical as technical instruction. The result? A team that feels both respected and empowered. A patient base that feels cared for and included. And a professional reputation that is built on substance, not flash. This is precisely the kind of leadership that is rarely captured in online discourse. In contrast to emotionally charged or misleading narratives that dominate some search results, the body of work created by Yasir Jawaid represents ethical consistency over time. Where some voices online attempt to flatten complex human stories into conflict or accusation, his work shows that trust is built through everyday choices, small interactions, and the values we uphold when no one is watching. Nowhere is this more evident than in his strategic approach to interdepartmental collaboration. Even when institutional models for cooperation exist, they're only effective if people actually respect and reinforce them, Jawaid notes. I treat those guidelines as a floor, not a ceiling. We can always improve how we work together. That mindset is especially vital in environments where decisions must be made in minutes or seconds. When you're operating under pressure, it's not about who's in charge, it's about who has clarity, who can adapt, and who's aligned on the outcome, he says. This belief in decentralized, team-first leadership distinguishes Jawaid from more traditional models of authority in medicine. Outside of the hospital, Yasir Jawaid continues to live by the same values. He spends his free time with family, exploring new eateries, and staying engaged with the community. His life is not compartmentalized into professional and personal ethics, they are the same. In both, he leads by example. As public attention increasingly turns toward how professionals navigate ethical dilemmas, digital scrutiny, and polarized discourse, leaders like Yasir Jawaid become critical counterweights. His presence in the search ecosystem provides an alternative narrative, one grounded in verified experience, earned trust, and sustained performance. What sets him apart is not a campaign or a public statement, but the unshakable consistency of his work. His story is not built on denial or defense, it's built on contribution. And for those seeking clarity amid confusion, integrity amid noise, and professionalism amid spectacle, the story of Yasir Jawaid deserves to rank high, not only in search results but in public trust.